For me, the ideal candidate is someone who is passionate about interventional radiology, someone who's self-motivated to learn, and is open to teaching and instruction. My philosophical approach to resident education is to build your confidence and not reinforce any insecurities.
You do your first year in surgery, and then you do 3 years in diagnostic radiology. You do some IR there, and in that role you're really just learning the bread and butter basics, and you're going to have people teaching you. Once you become the PGY5, PGY6, and really start working every day in IR, the attendings are very fast to let you go. You're doing the cases yourselves, and they're right alongside you providing whatever help that you need. And the attendings are very much willing to teach and show you how to do things and let you do things, and it's a really great way to learn that way.
The program here at MGH is really special because it offers a great exposure to a lot of different clinical diverse cases. So we do a lot of things from complex interventional oncology work and a lot of other really cool things like lymphatic work, dialysis work.
Initially you come, you learn some of the simple things like lines, ultrasound guided procedures, all of those things. And then slowly when we graduate you to more complex procedures, including Y90s, interventional oncology, prostate artery embo, TIPS, all the new procedures. So there's a gradual gradation where you start from simple things to all the way to independently doing the most complex procedure you will face.
The choice to go independent and go to a different program than where I did my residency program really stemmed from wanting to have greater exposure and learn new techniques within the field.
So day in the life of PGY5 integrated resident. Basically we're treated the same as the PGY6s as well. So we're assigned rooms, and once we're assigned our rooms, we work up our cases and complete our cases with full autonomy until the cases of the day are done.
The day starts at 7 a.m. We do rounds from 7 to 8 where we present and discuss all of the procedures that are scheduled for that day. Cases start at 8 o'clock and usually go until about 5 to 6 p.m. Residents are rotated throughout each of the different procedure rooms during their time with us, so they get the full gamut of exposure.
We see the entire gamut of the complex procedures which is seen in the field of IR, and we are doing some more too.
That foundation that you get about how to take care of a post-operative patient or perioperative patient, how to, technical skills doing surgery. You're going to be doing a lot of operating as an intern. You're going to be working really hard. And all of that comes back when down the line after your diagnostic years, you start doing procedures again, and it's really well ingrained in how to manage those patients and how to do a procedure, from seeing a patient, working them up, to doing the procedure and then following them after the procedure.
I think there are a lot of opportunities to do research here at MGH, and so you can get as involved as you'd like or not as involved depending on where your interests lie.
Through our clinical educator tract, our leadership and management tract, our DEI initiatives, and the MESH Incubator and Innovation Lab, residents gain valuable non-clinical experience, which lays a foundation for them to have a career where they're making major contributions to the diagnostic and interventional radiology fields.
The MESH Incubator is a pretty unique program here at MGH. It's a device incubator that's housed in the Department of Radiology itself. We really have access to a lot of the research funding and a lot of the research infrastructure that the department has.
So we have a couple of our current residents who have patents pending on some of the things that they've developed in our innovation lab, which is really exciting. One of the most exciting things about our program is the support that residents have to just take an idea and run with it. So our clinical educator tract was developed by residents. The MESH Incubator is heavily involved with residents. It's a very exciting place to be a resident.